KZ started its operations in 1935 with a small laboratory located in Parma, Italy by Dr. Giacomo KZ. KZ is an international research-focused pharmaceutical company producing innovative pharmaceutical solutions to improve the quality of human life. KZ Group of Companies has its major pharmaceutical, state-of-the-art manufacturing facilities in Italy, Brazil, and France, and is operating in more than 60 countries of the world. At KZ, our prime focus is to provide innovative therapeutic options to improve the quality of human life. KZ is investing millions of euros in 5 of its research and development centers located in Parma, Italy, Paris, France, Chippenham, UK, Cary, USA, and Lidingö, Sweden. KZ Group is one of the largest B Corp certified pharmaceutical company of the world. Benefit corporations are socially and environmentally responsible companies focusing on strategic development goals set by the United Nations to make the world feel better. KZ is enjoying the confidence of millions of healthcare professionals through research-oriented, well-documented, and trusted product portfolio. This substantial product portfolio is backed by internationally published recommendations and further authenticated by EMA and FDA. One of the flagship products of KZ is Brexin. Brexin is based on the state-of-the-art technologies, host-guest complexation, and lyophilization. Brexin is ever first lyophilized NSAID of Pakistan in tablet form. Lyophilization is a process of dehydration of active pharmaceutical ingredient which involves freezing the product by lowering the temperature and then removing water molecules by sublimation, leaving behind a highly porous structure. The amazing advantage of this expensive technology is the fastest disintegration of Brexin tablet in GI mucosa, leading to fastest dissolution, which ensures complete solubility within no time. Brexin is the first ever application of Nobel Prize-winning technology, host-guest chemistry to medicine. Host-guest complexation, also known as supermolecular engineering, earned the Nobel Prize for Chemistry in 1987 for 3 professors, Cram, Pedersen, and Lehen. Brexin comprises of single guest molecule of piroxicam and host molecule of beta-cyclodextrine, which has a cavity in its own structure and has the characteristics to encapsulate specific molecules, thus making a complex, which is a result of weak bonding. In host-guest complexation technology, the host molecule of beta-cyclodextrine having a hydrophilic cavity filled with water molecules and the guest molecule of piroxicam having a hydrophobic segment approach the host molecule, which repels the water molecules from the cavity, forming a complex that is completely surrounded by water molecules. Thanks to the molecular inclusion, each molecule is separated from the other. These supermolecules achieved what seems to be impossible according to the classic laws of physics and chemistry. Instead of crystals, a new molecular complex of piroxicam beta-cyclodextrine as new entity Brexin comes into existence, which is highly soluble as compared to ordinary NSAIDs. That is why the United States Adopted Names Council and Food and Drug Administration has classified Brexin as a new entity. As you know, all conventional NSAID tablets and capsule are made up of large crystals, and even their fast-dissolving dosage formulations have small crystals, having an aggregate of millions of molecules. Crystals being covalently bonded take longer time to convert to free molecular form ready for absorption. Crystals, either large or small, must first convert into molecules for absorption, while in the case of Brexin, no crystals, but millions of free molecules are readily available for fastest absorption. The most important feature of this complex is molecular separation because of the weak bonding between beta-cyclodextrine and piroxicam. Therefore, once a tablet of Brexin reaches the gastric mucosa, it immediately dissociates to release active ingredient, which lead to much higher plasma concentrations, eventually making it ready for fastest absorption, ensuring fastest pain relief due to fastest and strongest analgesia. Brexin ensures plentiful advantages due to host-guest complexation and lyophilization. Brexin has high solubility due to fastest disintegration and dissolution, leading to rapid absorption, resulting in prompt and higher plasma concentrations, due to which fastest and strongest analgesia is achieved. Moreover, Brexin offers excellent gastrointestinal safety. Chemico-analytical studies have shown that Brexin has solubility 50 times higher than that of plain piroxicam. Absorption of Brexin is extremely rapid. Brexin takes almost no time in achieving fastest and strongest analgesic effect. Plasma levels during the first 2 hours after administration with Brexin are 2 times higher than ordinary piroxicam. Peak plasma levels are achieved within 15 to 20 minutes with Brexin, while it takes 1 to 2 hours with ordinary piroxicam. Brexin offers fastest and strongest analgesia as compared to ordinary piroxicam dispersible tablet and capsule. The analgesic effect is achieved within no time in most of the cases. Brexin offers prolonged analgesic and anti-inflammatory effect, as pain intensity difference over 24 hours showed that Brexin was faster in inducing an analgesic effect than dispersible piroxicam and was long-lasting. We proudly claim that Brexin is injectable potency in oral form, as it is confirmed in this clinical trial when Brexin was compared with diclofenac intramuscular and ketoprofen intramuscular. Brexin was associated with shorter time to attain maximum analgesic effect than diclofenac intramuscular and ketoprofen intramuscular. In another clinical study, Brexin was compared with piroxicam intramuscular. The results showed that a higher percentage of patients treated with Brexin were pain-free compared to the patients treated with piroxicam intramuscular. Brexin offers fastest and strongest analgesia in acute rheumatic pain. Brexin showed fastest analgesic and anti-inflammatory action than piroxicam in patients with acute musculoskeletal and articular pain. Pain intensity remarkably decreased with Brexin in comparison to piroxicam. Thus, Brexin becomes the drug of first choice in acute painful conditions. In another multi-center clinical study, 3,729 patients treated with Brexin 20 mg once daily for 7 days in the treatment of traumatic pathologies, acute musculoskeletal conditions, soft tissue contusions, and post-traumatic pain that require anti-inflammatory and analgesic therapy. Both physician and patients assessed reduction in pain intensity as excellent or good in more than 90% of the cases. Professor of Rheumatology, University of Miami School of Medicine, Miami, Florida, USA, Roy D. Altman, authenticates that the rapid absorption of Brexin can provide prompt symptomatic benefit. The study suggests fewer gastrointestinal side effects with this method of delivery. The combination of rapid onset, prolonged half-life of the drug, and a reduced adverse event profile suggests that Brexin is a welcome addition to our armamentarium in the fight against rheumatic diseases. Not only in acute pain, Brexin also ensures remarkable efficacy in chronic rheumatic pain. Results of a clinical study showed that functional limitation and quality of life improved significantly with Brexin and the long-term treatment for 6 months. There was remarkable reduction of pain on pressure, pain on movement, spontaneous pain, and joint swelling. Therefore, Brexin becomes the suitable choice of NSAID for the long-term treatment of rheumatic diseases. Brexin showed outstanding clinical efficacy in post-operative pain following major orthopedic surgery. In this comparative clinical trial, Brexin versus piroxicam intramuscular, Brexin ensured fastest and effective analgesia. Moreover, at the end of the study, 73% patients were pain-free with Brexin as compared to 57% treated with piroxicam intramuscular. So the result of this trial further substantiates our claim that Brexin is injectable potency in oral form. In osteoarthritis, Brexin ensures significantly fastest and longer-lasting analgesic effect as compared to diclofenac sodium. In patients with acute lower back pain or acute flare-ups of chronic lower back pain, Brexin ensures significant improvement from baseline for all efficacy parameters after 8 days treatment. Brexin has fastest onset of analgesic activity after the first dosage administration. Brexin ensures remarkable efficacy in chronic back pain. Brexin efficacy was assessed superb by more than 90% patients, while 87% physicians rated Brexin pain relief as good or excellent. Brexin offers superior efficacy in dysmenorrhea in direct comparison with naproxen sodium and ensures fastest and long-lasting pain relief. As shown in this graph, a higher percentage of very good or excellent results were achieved with Brexin 20 mg and 40 mg per day compared with naproxen sodium and placebo. It has been reported that in women affected with dysmenorrhea, there is an increase in the levels of prostaglandins, mainly PGF2-alpha, produced and released by the endometrial tissues during the menstrual period. Brexin inhibits the activity of cyclooxygenase, which converts arachidonic acid into various prostaglandins, therefore aim to treat the cause of primary dysmenorrhea rather than just symptoms. The fastest and strongest analgesia of Brexin was measured in the treatment of headaches. The onset of analgesic effect of Brexin occurred within 20 to 30 minutes after administration versus 40 to 70 minutes for naproxen. Resultantly, Brexin was faster, longer lasting, and more pronounced than naproxen. Headaches are chronic or recurrent, and these are usually manifested as migraine or non-specific primary headaches, and this is consistent with the observation that prostaglandins are involved in genesis of acute migraine attacks. Brexin inhibits prostaglandin synthesis along with the platelet aggregation, which is associated with the release of vasoactive substances that are known to participate in migraine attacks. In patients with primary headache, tension headache, and migraine mixed headache, Brexin analgesic efficacy was significantly better as compared to plain piroxicam, dispersible piroxicam, and naproxen sodium after a single dose administration. In patients with migraine without aura, Brexin analgesic efficacy was found significantly better as compared to indomethacin and naproxen sodium. Brexin authenticates clear-cut superiority in acute sports injuries over naproxen sodium. Brexin effectively reduced initial pain on movement in athletes with acute sports injuries. Brexin was significantly more effective than naproxen sodium 550 mg in improving isometric strength of the injured muscle and in improving articular mobility of the injured segment. Moreover, functional recovery was more marked in patients treated with Brexin as compared to naproxen sodium. Here you can see in this pie chart, isometric strength of the muscles recovered in 45.3% of the patients compared to 17.7% with naproxen sodium, while angular mobility recovered in 22.8% of patients, then only 8% with naproxen sodium. The result of this study shows that piroxicam beta-cyclodextrine is efficacious and well tolerated. Brexin therefore adds to the armamentarium of the sports medicine, a molecule capable of treating the inflammatory processes very frequently encountered in athletes after oral administration. There is a reasonable reduction in pain in just a few minutes, which can be maintained for a number of days with very limited side effects, allowing an early resumption of training activities. The short-term analgesic effect of Brexin was compared with plain piroxicam and placebo in a group of 30 volunteers. Brexin produced marked increase in reaction time compared with baseline, which was indicative of a strong analgesic effect. Treatment with placebo produced no overall modification of reaction time in response to thermal stimulation. Treatment with Brexin 2 days before a tooth extraction produced the best analgesic effect, as shown by the percentage change in pain intensity difference. Treatment initiated before surgery produced an earlier analgesic effect. Brexin showed regression of pain immediately, with 90% decrease in pain score observed within 24 hours. Brexin was assessed in patients with orofacial pain of varying etiologies, including pain arising as a result of tooth extraction, oral surgery, trauma, and maxillofacial surgery. Results of this study showed that the use of Brexin in the management of pain associated with orofacial pain produces excellent analgesia, which is fast in onset of action and of sufficient duration. Not only the efficacy, but Brexin offers excellent gastrointestinal safety profile. All NSAIDs are in large or small crystals. First, they convert into molecules, and then they absorb through the GI tract, and it takes 2 to 4 hours. The longer they stay at GI mucosa, the greater the damaging effect. On the other hand, Brexin is available in the form of free molecules, which pass through endothelial mucosal layer within no time. Therefore, Brexin has negligible time to stay at GI mucosa, thus significantly reducing adverse effect. Brexin showed excellent gastrointestinal safety profile in a study conducted over 9,105 patients for 50 days. There were only 9% incidence of mild GI side effects reported. The excellent gastrointestinal safety profile is clearly evident, as low incidence of gastrointestinal lesions were seen as compared to piroxicam, and it was almost similar to placebo. Similarly, only 5.2% secondary gastrointestinal side effects were observed, as compared to oxycam's 16.6% and 30% with other NSAIDs. Therefore, we can conclude that overall studies suggest a better GI tolerability of Brexin after 4 weeks of treatment, and the cumulative fecal blood loss was less for Brexin than for piroxicam. A meta-analysis conducted by Professor of University of Parma, Dr. Carmelo Scarpignato, concluded that Brexin, piroxicam beta-cyclodextrin, has been used in Europe and South America for over 25 years. Preclinical and clinical pharmacology of Brexin shows that the beta-cyclodextrin inclusion complex of piroxicam is better tolerated from the upper GI tract than free piroxicam, while retaining all the analgesic and anti-inflammatory properties of the parent compound. In addition, the drug is endowed with a quick absorption rate, which translates into faster onset of analgesic activity and effect confirmed in several clinical studies. Brexin offers unique advantages and matchless benefits for patients with painful manifestations. Brexin, the only NSAID brand in Pakistan, ensuring fastest pain relief due to fastest and strongest analgesic, potent anti-inflammatory effect, along with excellent gastrointestinal safety. Brexin, the only NSAID brand in Pakistan based on the state-of-the-art technologies, post-guest complexation and lyophilization. Brexin, the only NSAID brand in Pakistan, being manufactured in Italy with unmatched EMA-approved European quality standards. Brexin, the only NSAID brand in Pakistan, imported yet available at locally competitive price, offering dosage convenience. One Brexin, once daily. Due to more than 30 years of trust and confidence of the healthcare professionals, Brexin has become the #1 NSAID brand in Pakistan. Thanks a million for making Brexin the #1 NSAID brand.